Always
more,
a pleasure.
and certainly more. Um, Tuesday, we're here.
Hmm.
We're already, what, the 15th, so we're halfway
Yeah,
through the month.
we are.
What has it been like for you? I know you're wearing our little
I
ribbons and
know I'm underdressed today compared to you. You're full out pink.
listen, you just throw me off because every time I think I match your energy with one of those things, you come with a hyped up one.
I
So
had to come with something today
um,
because the rest of me
the
is not
rest of
in
you
pink.
say, so you know what that means? No, I need one of those.
Yeah, no problem. I'm leaving it for you. I'm leaving it for you.
Wonderful. How you
Yes,
been? How
I'm
has it
good.
been?
I'm
How has it been
good.
in the society? Um, how is it?
This month, actually, I find this year has been fairly quiet
I find so
compared to
too.
last year. And last year I was all hyped up because I think we had She Speaks maybe
Right.
later on in the month. I was commenting that we had so much activity and so much awareness that
True.
all the business places were in pink.
Okay.
I've been walking around and I see like just snippets
Oh
and
yeah.
just a little bit of pink, and I'm
Oh,
wondering what happened this time around.
oh gosh.
Last year we had the Ministry of Health, Faces of Cancer, and Central Cancer
Yes.
Society just blasting and trying to get everybody to do pink. So I'm hoping maybe by the end of the month, the last 2 or 3 Fridays that we have, that people will continue and try to maintain at least some sort of momentum.
Well, at least you're here to remind because
Yes,
it was cool. It's a lot going on this month. A lot of
yes,
distractions with
always.
the juju and the kings, and we had a lot going
Exactly.
on. So hopefully,
Exactly.
persons are settled in by now, and the message
Exactly.
can get across as well. Let's
Yep.
talk in terms of what we're looking like. I mean, the advocacy continues.
Hmm.
You and your team has been doing your part. The other NGOs aligned to that has been doing their part.
Right.
Um, you are very well placed to know what our numbers are looking like and stuff like that. Have we been seeing any improvement in terms of numbers?
No, we've been. I don't. I
Oh,
don't see that the numbers are going down,
oh.
and
Is it getting higher? Is it going up?
it is going up.
Oh
It is.
gosh,
I don't have the exact figures because we're still
right.
compiling, and as is being seen throughout the world, and certainly U.S. figures, you're seeing more and more younger women, although the majority are still older women. And when I say older, we're talking about 60 and older. But we are definitely seeing younger and younger women, and it just kind of makes you wonder why.
Why? But I'm here
Why?
thinking why too. We still don't have a handle as to
No,
what is contributing to that
no.
rise.
Recently, we talk about the science part of
Hmm.
things, and we talk about genetics, we talk about all the exposures and things in the environment
Yeah.
that can probably lead to cancer. And it is true that up to 90% of cancers are actually because of the things that we do.
Right.
I really think that what we eat, how we live,
Right.
really has a huge influence
Hmm.
on what's happening. We've seen an increase in obesity, which is linked to so many chronic diseases. Cancer is no different. Um, but we still don't have a handle on it. And it's really distressing. And that's probably where I wanted to talk more about today, like
Yeah.
where we're really not making an impact. So last year we spoke about things being improved in terms of oncology, in terms of
Yeah.
drugs being available, the CT scans, people being more aware of the modalities that are necessary. But every single time that I meet a new patient who says to me, "Oh, I didn't know that I could access care in a public system," or they get a huge bill for treatment and
Hmm.
they're stuck because they're trying to raise funds and time is just passing by. And I go, "But you could come to the hospital. You could access public care. Like nobody told me this." So in terms of patient navigation, I think we're not doing very well there. And when I say navigation, I mean anybody who's been given a diagnosis of cancer, what to do next.
Right.
The conversation, breaking it down into layman terms as to what is your cancer? What does stage mean? So most
Yeah.
people know to ask the first question, how far along is it?
Right.
But to break it down, so when a doctor says you're stage 2,
Two.
stage 3, they're like, "I
Right.
don't know what that is." I've had patients now who have been treating me, like, for 5, 6 years. They're like, "Doc, I never really asked what type of breast cancer it is that I had." And I'm like, "Okay, that's good that you want to know, but, like, have you read up on it? Like, if I tell you it's ductal, if I tell you it's something else, like,
Hmm.
would you know the difference?" But I think for those persons who've been going through the journey, they are becoming a lot more aware,
Hmm.
but the information is not necessarily trickling down to like new people.
Right.
And even though we have support systems and support groups, cancer is still pretty personal. pretty taboo,
Mhm.
quiet, and you would know because you're
Yeah.
always asking, "Can we get some
Yes.
survivors to come?" And the
Yes.
patients that I know, they're like, "Oh, I don't think the solution public is ready for me," and they're very shy about it. So there's still a lot that needs to actually be done, and I don't know when we're going to see the numbers actually decrease. And I only think this is just my personal point of view,
Mhm.
that we're going to see a reduction in a lot of these things when we get the young people involved, because their habits, their lifestyles are what really is going to make a difference in the next 20 to 30 years.
That's a tall
So
order, isn't it?
it is. So, on the one hand, we're pushing and advocating and
Yes.
educating. And then on the other hand, you ask yourself, are we making a difference? It's kind of, maybe that's why we've been a little bit quiet this year. I don't know the reasons, but you're just looking around and going, are we making
Feeling
a
a little
dent?
hopeless.
That's
Well,
a big
hopeless is a
word.
big word,
It's a big
and you
word.
don't want to really use it now, but
Not at
it's a
all.
fact.
You just have to ask yourself, are we making a dent? And my personality is one where you work hard, you try hard, and you expect to see the results. I've had to kind of tailor my thought processes now to, if I can affect one person or impact
Oh,
one person,
okay.
I'm happy.
Right.
But there's just so much more that needs to be done, that you just kind of go, okay, I have to take it one step at a time and not just be disappointed or feel like, this is a failure,
Right.
that you've been trying, but you're not trying to figure out where the miscommunication is, why
Right.
you're not able to impact.
Right. Now, you mentioned earlier, when you talk about patients or persons being diagnosed not understanding or not knowing that they can reach out or they can look towards the public health
Hmm.
to be able to deal with that. Now, I am one, I think maybe that's a very real thing, because even me and my mindset and my thought pattern, when I think, if I was to think, okay, if I get cancer, it always comes across as a private road.
Right.
It doesn't. It never crossed my mind to say, well, all right, let me go through the public.
Hmm.
Is there what's the word? Is there merit to that thought pattern? Is there well? Do you stand a better chance, or is it the same care? Can you rely on the public um,
Public health
health
sector.
sector the same way you can put your confidence or
Right.
into the private?
Well, let me start off by saying that cancer treatments are expensive,
It
no
is.
matter where.
Uh-huh.
Your cancer treatments are always going to be expensive privately.
Yeah.
It does not always mean that it's different medications or a different brand of medication. It's your ability to access and perhaps get through things maybe a little bit quicker. I will also say that the majority of us who work privately are also in the public sector.
Okay.
So I have a private office, but I am at OPEU every single day.
Yeah.
The oncologist, a lot of us as the surgeons, gynecologists. So there aren't that many of us to say that we're purely or strictly private. There are a couple.
Mhm.
And so I think it would really reflect badly on us if we offered a different type of healthcare
Uh-huh.
in my office as compared to at the hospital. I
Okay.
mean, a patient would really and truly have to question me, because my values and my
Mm,
ethics would really have to be questioned.
absolutely.
There are a lot of myths. So, for example, people have said, well, you get a lesser brand of chemotherapy
Right.
in the public sector.
Uh-huh.
That's not true. And if we as the doctors are prescribing those lesser brands, then you need to take us to task. I mean, why would we be giving patients chemotherapy that's not good or not of the standard? So I really want to clear that up, that
Awesome.
the standard is the same. Yes, there are some delays because you have to get the medications maybe in bulk, the timing, etc. But we've gone a long way trying to limit those delays, right?
Mhm.
Anybody who's been to my office, and I speak, I think, for the majority of my colleagues, if you have cancer, it doesn't matter. It doesn't matter if you see me in my office. If you can't afford surgery at the hospital where I also work, I put you on my next list at OKAU, right? If you need to see my oncologist, I write a letter. It takes nothing, I think, out of us in the private sector to understand if a patient cannot afford.
Mhm.
And if we have colleagues who are not being true to our patients, then we need to pull them up.
Absolutely.
Um, and I feel very, very strongly about that, because at the end of the day, it's patients' lives, and we need to dispel a lot of those fears and untruths.
Okay.
So I will go on record and say that the public care is comparative
Mhm.
to private. Um, if you call my office, you may get an earlier appointment to see me.
Mhm.
Um, but if you need to come back to see me in the public sector, I'll write a note so you can see me the next week.
Ah.
So, again, I think when I say that, that I am speaking on behalf of a lot of my colleagues who work in both sectors. And so there really should be no patient or no person in St. Lucia who's telling me or us at the Cancer Society when they submit these huge treatment bills that I didn't know. I didn't know that I could come for the same amount of for less money to
Right.
get your treatment and probably would have completed it in a much shorter period of time.
Wow.
So that's definitely one of the
Well,
hiccups in the
well, I think that
system.
is a very good bit of information to send out there because you're right. It is a big myth, and a lot of people are walking around with with
Hmm.
that belief.
Yeah.
So I think we could start. Well, maybe the next step of advocacy could be along the line of education
True. That
in this
yes,
direction.
exactly.
You
I
know.
mean, there's no doubt that the more advanced therapies, we don't necessarily have them here. So if you need radiation, if you need certain types of surgery, we will not be able to offer everything here. But at
Mhm.
least you would know,
Right.
you
But
know?
if we also do the early detections and we catch those early,
Exactly.
so it goes back down
Exactly. It
again
goes
to
back down,
the
right?
same advocacy for early detection.
Exactly. Exactly.
Oh gosh.
So stressing on, so everybody asks about mammograms, the usual questions. And personally I've always said the position, and again a lot of this is personal, because I wear several caps. So I'm
Mm-hmm.
a general secretary, I do a lot of the press. I'm also president of the Cancer Society. So if we have a limited amount of money, let's just say as a nation, it's not just Cancer Society, you may not be able to afford paying for mammograms or subsidizing, although it's not that many women between the age of 45 and 55 who we think should have a mammogram every year.
Right.
It costs absolutely nothing to get women to touch their breasts, women and men. And no, it's not regarded as screening, meaning
Mm-hmm.
where we pick up things before you have a symptom or a lump.
Right.
But certainly, the smaller that you pick up the lump is the earlier that the disease tends to be. And so you will spend less money in terms of your treatment. So there are different ways that we can actually approach advocacy to education. Yes, we're still going to be pushing for mammograms in the appropriate age groups. We're
Mm-hmm.
still going to be pushing from you start growing boobs, male or
Mm-hmm.
female, to learn to examine them. If you feel something, you need to come to the doctor.
Okay.
I think that's the cheapest, more effective way to actually pick up things. So the money that you have, you actually spend on proper treatments, and it's going to be less than if you have to just be sending people to Martinique. Radiation costs up to 15,000 US dollars. You
Okay.
understand? So surgery in the public sector is $1,000, right? That's the cheapest part of your treatment, depending on which surgery you need, but that's like a cap. The
Mhm.
surgical procedure itself, chemotherapy, depending on which medications, is maybe $2,000 to $4,000. Radiation is 15,000 US dollars,
Wow.
right? So we want to keep it. We don't want it to get cancer, right?
Mm-mm.
But if you do, we want to treat you earlier. So it's really just about reiterating those messages and, again, trying to dispel. We also, so that's one in terms of access. Where
Mhm.
is it available? Um, the other thing that I tend to tell my patients is, yeah, there's a lot if you read up online, you need to get a CT scan of this, a CT scan of that.
Mhm.
And yes, a CT scan is by all means more reliable than an ultrasound,
Mhm.
but there's a role for ultrasounds and x-rays. So again, if you have $3,000, your chemotherapy is going to cost you $2,000.
Mhm.
You don't have $2,000 to do a CT scan, but you might have $500 to do an ultrasound and your x-rays. So again, the information,
Yeah.
prioritize. Doing
Yeah.
a CT scan is not going to be your treatment. It's an investigation.
Okay.
Save your $2,000 on how much ever your chemo is going to cost you, because that's what's going to make a difference. So again, we have patients who are, and at the Cancer Society, if we help you, we can probably help you once, and there's a cap. So if you're going to come to us for assistance, financial assistance, and you're asking me for $2,000 for a CT scan,
Mm.
you may not be able to come back to ask for 2005
For the
for
actual
chemo.
treatment.
right? And
Oh,
so again, it's kind of difficult because I wear different caps. It's almost invasive for me to be like, did
no,
somebody tell you that you don't have to get this because you're not my patient, right? But I
no,
have the information.
yeah.
So I'm really appealing to colleagues and people in the medical fraternity to have the conversations with the patients because the treatment is what it is that they need.
Most.
And we need to be on the side of the patient always. They should not be thinking that all we're after is their money and not necessarily caring about them as
Mhm.
individuals. Because there's so much that can be offered in the public sector. And it's a reflection of us in the public sector if we're not treating our patients the way that they're supposed to.
Absolutely.
Yeah, there are limitations. The hospitals has been in the news, what we have and what we don't have.
Yeah.
But we can make a difference for sure if we do our part.
Someone is asking, is someone who has had what's it?
Benign?
Benign breast cysts more susceptible to breast cancer in the future?
Not necessarily.
Okay.
There are different causes for cysts. Some
Mhm,
people can have a solitary or single cyst,
mhm.
which can the same way you get a cyst on your ovary, a cyst on your liver, you can get
Okay.
a cyst in your breast.
Mhm,
There is a disease called fibrocystic breast disease, which is very common in our fertile age.
mhm.
And so most persons will know when their menses are coming based on how the breasts feel. They're
Yes.
very sensitive because they're sensitive to the hormones.
Right.
In patients like that, there's a slightly increased risk of breast cancer just because there's so much activity going on in the breast.
Oh,
It is also a little bit more difficult to do your breast exams because your boobies are probably a lot more
yeah.
lumpy and you're like, oh my gosh,
Oh, no.
right? What is this?
Yeah. Oh,
But if you're anything
geez.
like me, like there are certain parts of my breast which I know based on the time of the month are going to
Mhm.
feel different.
Right.
And then afterwards, you're like, okay, it's back to normal. You
Right.
freak out a little bit when it doesn't go back to normal. But as you get closer to
Right.
menopause, things don't line up the way they're supposed to.
Okay.
So the message again, especially if you have lumpy kind of breasts, is to become very intimate with your breasts. Know where
Yes.
your lumpiness areas are,
Right.
and just keep an eye on those. But fibrocystic breast tends to make it a little bit more difficult,
Wow.
and patients get a lot more anxious.
Oh gosh.
So
Listen, it was so vital to have had you this morning. I like the angle we took. It was quite a different one.
mhm,
Um, and I think it's a nice direction to start um, a new conversation, maybe.
mhm.
Or maybe not new, but new to
I think
most.
it's new. I think
Yeah,
it's new
it's
instead of
new.
the
It is new.
usual. What's the breast?
Yes.
What are the symptoms,
Yes, I
etc.
love
But
this. I absolutely love this. And these sort of conversation, well, you of course, but you have so much going on. I mean, when you meet with your colleagues, is that some of the conversation that you normally have in terms of how it is that you know relate to your because as part of the Cancer Society
mhm,
again, this is the next role that you
right,
play. This is very vital now for you to you will need doctors to start having these conversations now
exactly,
with the patient, to
exactly.
better enhance the knowledge and,
Yeah.
and guide.
So every 2 weeks at the hospital, we have a multidisciplinary tumor board meeting,
Hmm.
and that involves all the surgeons, gynecologists, pathologists, oncologists, and we sit and discuss each patient. And so these topics come up, but as a small group of people. And
Yes.
so, yeah, the Cancer Society should also be tasked with continuing medical education and having sessions like these for our SNMBA colleagues,
Mhm.
where we just remind them, let them know what the issues are that we're seeing, and just try to get everybody on board because as doctors we still also need to be reminded of certain things, and we did
Absolutely.
take an oath,
Yeah.
and sometimes it's not because we can't, sometimes it's because we just don't know.
Is it an
And so
overload for you though? Because I mean, you're so passionate about this. So as a doctor, you are giving 1,000% of yourself. We
yes,
know that. I mean, I
yes,
personally know that. But then here now it's the Cancer Society. You have to now take up the mandate and go on over there and, you know, take on so many other. Is it an overload?
it's a lot,
So
it's a lot.
how can we help? How can how can
What
we help? Let's we can't come over to your professional side of things,
that's
but
fine.
at least through the Cancer Society, how can we make a difference? How can corporate solution make a difference? How can we as just regular people make a difference? How can
We
we
need volunteers.
volunteers?
We
Okay, now
need
talk to me.
volunteers. And I will also say that we do get some volunteers, and I will take that one personally as well. I don't know that we have held on to a lot of our volunteers because there's so much. So We want people to come to help in terms of volunteering their time. We would love people who have the gift of imparting knowledge
Mhm.
to join us. I am available and I'm interested in offering courses where you can actually get a little certificate that says I have learned how to talk about breast
Why that one
exams,
fall on my
etc.
plate?
Exactly. And I must
Ouch.
say, RCI is always on board. We had Relay for
Absolutely.
Life. Anytime there's something happening with the Cancer Society, CIBC knows that I'm always pressuring them because right now the walk for the cure, CIBC is the
Yeah.
only cancer walk. Although I
Yes.
just realized Glasgow has a 4 mile walk, which I didn't even
Yes.
know
Yes, they
about
do. They
until
actually do.
this week.
Right.
After it already passed. And I think it
Oh,
clashed with the CIBC walk
yeah.
in the north. But this is the only walk that is for cancer, CIBC's walk. It should be massive, you
Yes.
know.
Yeah.
So we need volunteers. We need volunteers to go into the schools,
Hmm.
corporate and Lucia. We've been trying to get you on board because you all want to do things in your communities.
Right.
And I think it starts with the youth. Obviously, donations, etc., will go a long way because we try to help our clients and our patients. We've just started nutritional assessments at the Cancer Society. So anybody who wants help with their nutrition, with weight, etc., we've just started that and patient navigation services. So yes,
Quite a lot. And
yes,
Doc, the conversation, and someone just said we need the education year round, not just the month of October.
totally
And I
agree.
totally agree with that. And we would not dispute that at all. We agree on that. So, I mean, in closing, Doc, what do you like to depart? I mean, you departed so much already, but I'm sure there's this drive home that you wanna leave.
So there's a lot of information available for any kind of cancer journey in St. Lucia. You need to find that information. You can find it at the Cancer Society. Any of your doctors should be able to. If not, you reach out to us. You reach out
Mhm.
to me personally. Um, but cancer, as we've been saying, is not a death sentence. We have so many thrivers. I don't even call them survivors anymore. Thrivers, and we need to do our part as individuals, as doctors. We also need to do our part. But more so, I would love for people to understand that it's a journey that any of us
Mhm.
can go through. Um, and you don't have to have, yes, it's expensive, but you don't have to have money and travel overseas in order to survive and beat the journey. So let's have the conversations and let's do what it is that we need to do. And reach out to the Cancer Society. We have lots of information that we can impart.
Absolutely. Again, it's always such an honor. And we admire you and we would like to say thank you for all that you do within that field as well, because we know it's not easy. We know
I
it's
try.
not easy.
I
Oh, you've
try.
been doing. You do more than try. You're definitely doing, and
Yeah.
giving up your, the little time that you have to put so much into that. I'm sure, it goes a very long way, especially for the people who are affected and is
Yes.
able to rely on some of the things that you you channel. So thank you on
My
behalf of
pleasure.
others, and thank you for always making the time to
Yes.
be
Thanks for
with
always
us.
inviting me.
You better understand because we invite.
No
We're
problem.
definitely going to be inviting you. Thank you again, and have an awesome, awesome rest of the
Thank you.
of the
You
month. And
too.
we're here as
Yes.
always,
As
doing our part
always.
because you do yours. So let's all
Thank
bring it
you.
together.
Yes.
Wonderful, Dr. Tamara Remy, guys. Doctor, general practitioner, just a beautiful soul, just a nice human being, And of course, she's also as a nice human being, is giving a lot of her time to ensuring that the St. Lucia Cancer Society is thriving. And she does what she can, and we can get on board in whatever way, whatever capacity, because we all been given a gift. This is just it. Everybody has got something that they can contribute. I may not be able to give $1 million, but I can give my voice.
Definitely.
Right, you may be able to get $1 million and you're okay, me in a talking part, not for me. Go on to, so let's if we pull the resources and you
Exactly.
give what you can, you give what you're gifted in, and we all do that, you'll be surprised to see, and it don't take much from us because it's natural step in nature to us because this
Exactly.
is what we do. So if we do what we do and we put it there, you know,
Yes. It will
it
be a
becomes
whole.
it'll be a whole.
Yes.
So just always think of it like that. That's how I've been, starting to think of things recently, and it's working. It doesn't seem like such a burden
Yes.
after that, and I think that's where a lot
Exactly.
of people fall short because
Yeah.
they think about That's a lot right now. I can't matter
Exactly.
with that, you know. But if you
Mhm.
think of it, this is what I do. So let me just do what I do and just extend it a little
Exactly.
bit in that
Yes.
direction.
Mhm.
It goes a long way.
It does. It
So you know,
does. Definitely.
you know I'm there. Certainly, guys, that's our time. Thank you very much to everybody. Oh, Nisa Joseph Silly, she's also
Ah,
yes,
Lisa.
she's there. Marceline Fouchier Robinson. Good morning to you, Martha James, and to Martha, how you do? And everybody else that's tuned in. Thank you very much. And again, remember that little thing. We all can if we decide we want to, and it's not as difficult as it seems. All right, so that's our time for now. We go off the live, bye guys, and of course, Hyper is going to be coming on.